root canals only hurt whenever we're numbing you. I know a lot of patients have bad experiences with them, and that's just because if you're not fully numb when we're doing the root canal, that nerve is just going to be so irritated because at the end of the day, we are removing it from the tooth. So it does not like that. So if you are not numb, you will feel some sort of pain with it. So as long as you're able to communicate with us whenever we are going in, if you do feel something, let us know. We could always give you more medication, more lidocaine, just to help numb that nerve for you. During a procedure, you should not feel anything for a root canal. The numbness, you'll feel like your lip fat, your tongue fat, your cheek fat, but other than that, you might feel us working there, but you shouldn't feel any kind of sharp pain. You shouldn't feel any kind of throbbing pain. You'll feel us a little bit of pressure, if anything. You'll hear a lot of noises. You might taste some things, but in terms of pain, shouldn't very be minimal. Recovery period for a root canal is within 2 to 3 days. You should feel fine. Just because that nerve is the source of that pain, and once it is out, it should feel pain almost gone immediately. If not, you'll feel some kind of throbbiness, some kind of discomfort, just because we were in that tooth for a pretty long time, just making sure it's clean and making sure all the nerve pieces were out. So that's the only kind of discomfort that you really feel is after the fact of us just working on that tooth. But as far as like the pain that you came in with, so as far as like that throbbiness, that keeping you up at night kind of pain, that should be gone immediately. In terms of root canals, the only complications that you may experience is if, broken files. So while we're doing the procedures, files can break, but again, it's something that we can't really prevent. We do our best to keep everything at bay, so to help you save the tooth, but there are, broken files can happen if, some kind of perforation happens. So instead of going straight down the tooth when we're doing root canals, if the file bends a certain way and now it's up the side of the tooth, that sounds terrible, but it can happen and it can cause you to lose the tooth. There are definitely, if we do run into complications, we will refer you to an endodontist immediately. That way they could really just help give that tooth the best possible scenario of, for you to keep it. But if, we are even in the tooth and we're doing the root canal, if we do see any kind of cracks or anything like that, then that will immediately mean that that tooth does need to come out. And unfortunately, we can't see all the cracks on x-rays, and the only way we can see them is whenever we're actually working inside the tooth. And at that point, even if we tried to save the tooth, it might not be worth your time.